really nice to see you all, meet so many people, and thank you, Cypher, for organizing this great conference. I made a career change in March this year, decided to be fully focused on data science, and one of the first things that my manager, Anita Chanda Prakash, told me was, visit Cypher. She's been here many times, and I'm really happy that because of Corona it is now possible. I also realized that some of you would have expected to see my colleague here, Elia Lima Walton, who unfortunately early this morning found out her visum was not working. So I'm standing in for her, and I'm hoping to do an equally good job. And I hope next year she can be here and you all as well. So what will I be talking about? First of all, the mission of the company I work for, which is ELSEVIER. I've been with ELSEVIER for 23 years. I know yesterday I was visiting our Bangalore office, and when I said that, the young crowd there were all saying, well, 23 years, yeah. I love the company, I love the mission that we have, and I hope to get you equally excited about what we do in this presentation. I'll talk a bit about our services and our customers, but especially what we're doing with AI and data science, and especially in the medical field. I'm currently running the data science department focused on our health products, so serving physicians, nurses, and patients, and I'll be zooming in that topic. So first of all, who we are. We are a data analytics company, and we try to advance health and medical fields. I think many of you are familiar with our products, and I'll show you a few later on. We are combining content and technology, and that's very different from the time when I started at the company 23 years ago. We were mainly a print business, and the internet was happening, and everything was happening very fast, and a lot of people were thinking, what will the internet do to our business? And it turned out to be quite disruptive. Fortunately, we managed well, and now we're in a next transition where AI is disrupting our business, and we're developing a lot of new solutions that wouldn't have been possible 10 years ago. So these are some of our AI publications. Just curious, how many of you have seen these journals? They're scientific journals used at universities. Fortunately, yeah, quite a few of you. We publish them online on Science Direct, and in the past in print, though these are fairly new journals. But we have a lot more products. So we also have books like Grey's Anatomy. Not only that's a television series, it's actually a very well-known reference book. But a new type of products that we deliver are, for example, a three-dimensional anatomy model that helps medical students become familiar with the human anatomy. Again, these products were not there 20 years ago. Today, we're creating it, building on that huge collection of scientific and medical knowledge that we have. And maybe you've seen the BBC news item on it. We're also the first to have developed a detailed female, three-dimensional anatomy model. Another one of our products is in the field of chemistry. Again, we used to have only books and journals. Now we have huge databases where chemists can draw chemical structures, look at them three-dimensional, and find relevant scientific information related to that structure. Or maybe related structures, not exactly that structure, but related ones which can give very significant, important information for their research. Another example of a product we used to have and still have, but a much newer and advanced version of it, is a drug safety product that we developed. And this one is particularly close to my heart because I used to be the product manager for this product years ago. And what we did there was we took ELSEVIER drug safety information and publicly available drug safety information, and we indexed it, used text mining tools, but also the expertise of tens of medical professionals, and created a new database that provides drug safety information to researchers at pharmaceutical companies. And I think this is quite a nice quote from a researcher at Novartis. With Pharmapendium, I get information about how it was measured, and a click will show what source document it came from. Really important to always show the source. All very important for building robust, well-founded models. And in general, with all the examples that I will show, we sometimes make predictions or give recommendations, but we always back it up with our vast collection of medical, scientific, and science content. Well, this one I'll just flick over quickly. I try to mention a few examples in this presentation, but we have loads of products for researchers, for physicians, for basically everyone doing research in academics or corporates. So our customers, for researchers, they're very focused on Science Direct with our articles. Governments, they want to know what research to invest in. And we have products that analyze that worldwide. What research is being published by which institutes, which researchers have the biggest impact, and governments can make funding decisions using that data. Pharmaceutical companies, during their drug development process, use various number of products for us, not only the drug safety related products, but also products related to efficacy. And the way we present the information to them is again using data science to mine huge amount of data so that we're not only giving chapters or articles, but actually insights. Clinicians, this is the customer group that my department is currently serving. Clinicians at hospitals, working with patients, seeing a patient with certain symptoms, not being 100% sure what it might be. We have the tools that give suggestions and that back it up with trusted information to help them take a decision. So these are really products for point of care. And then the last one, medical and nursing students. We have various education programs and tools, and that they don't only provide the content, but we can also help a student and their institute predict if someone will, for example, pass a national exam in nursing, and on time as well, so that it still can be mitigated and that they know what to focus on and then hopefully pass. Yeah, so ELSEVIER, my company, also collaborates in a lot of AI research, and today at the stand we had several people already asking, would you like to collaborate? We have really more than 90 collaborations, and one is quite close to where I live in Amsterdam. We have 2 universities where we have about 10 interns, data science interns that we coach, but also people finishing their thesis jointly with us, and several postdocs doing research. Usually that research is long-term, so 2 or 3 year research project, and typically not so much focused on improving our products, but more the long-term questions that we have. Now let's zoom into the data science community. We have people in different locations. I mentioned a few here, but thanks to Corona, it's actually not that relevant anymore because many people have started working from home for a long time. And for example, my department is completely home-based. We meet at conferences like these, or sometimes we come together in a place for a local meetup, but most of us work from home. That's not the same for all the data science departments, by the way. So spread across the world, some data science groups are focused on life sciences content and developing algorithms on that content for the relevant products. Some focused on research in general, and others on health. Yeah, so one thing that I thought might be interesting to share is how we work together, so how we operate. And yeah, actually, I was sitting in one of the first keynote speaks this morning from Amaresh Tripathi, and there was one thing he said that really resonated with me, namely that it's a team and it's a collection of skill sets that we're bringing together. And that's what I see very much as well. There's very little a group of data scientists can do by themselves. It's always a huge collaboration. So at ELSEVIER, on the health part, we have a product organization, of course, very closely interacting with customers, so visiting hospitals, visiting medical schools, visiting nursing schools. We have a very big tech team, partially based in Bangalore and Chennai, by the way. And then we have the group of what we call the data science group. But interestingly, it's not only data scientists. There's also domain experts. So in my department, there's people who have a nursing background. We have several people that were a physician in the past. We have people that worked in pharmacy, someone who worked in drug development. So that subject matter expertise is needed to build the data sets that the data scientists use, but also to evaluate the output. And nothing that comes out of the algorithms is not checked by this group. And then lastly, we have knowledge representation specialists. Sometimes we call them taxonomists. They manage a really big medical taxonomy that we have created already. I think probably about 10, 15 years ago it started. And it's every day growing with new concepts that get added, again, using data science tools. The team is spread across the world. This is a little bit of vanity thing, and I couldn't help myself, but this is me 15 years ago in Chennai at a government building, getting actually the paperwork and the stamp to start an office in Chennai. And today that office is there in Ascendas, and several of our data science colleagues from Chennai are here. And if you like to meet them, please visit our booth. It's just outside there. And that was the first management team. So what does the data science health department focus on? There's 3 areas that are very important. The search experience of our health products. So we use NLP, machine learning, to continuously improve that search experience. We're extracting medical concepts from all the content we have. So those are books, journals, but it can also be a database of videos with medical procedures. We have the technology to index that and then link it to a huge taxonomy that we have, and use that again to improve the search experience. So that taxonomy gets loaded into a graph database and is helping medical professionals to find what they're looking for. We also use data science for platform integration. As you saw from the logos, we have a lot of products in ELSEVIER. Sometimes also for me, being here for 23 years, mind-boggling. But of course, we like to integrate them for the users. And that's also where we use data science, ontologies to help with that. Sometimes we acquire new companies, often now with video content, which very nicely adds to the content we already have, and we use ontologies, knowledge graphs to integrate. And lastly, because of machine translation, also globalization of our products has become a lot easier. So we use a combination of machine translation and again subject matter specialists to translate our products, and sometimes it's only the taxonomy so that the search is in a different language. Sometimes it's the whole product so that we can increase the reach of our products. And today we've done that for, for Spanish, French, Brazilian, Portuguese, and I'm missing, and German. So for those languages, but there's more languages coming up. Yeah, this is a bit of detail about the taxonomy. I'm not sure how many of you are familiar with a taxonomy or ontologies, but why it's so powerful for search is that you can have a medical term, say breast cancer, can be described in many different ways. So for a physician to do a really good search, they need to know all these different medical terms. We link them to the children concepts, so we create this tree, and of course also include synonyms and sometimes more end-user-friendly terminology to complete it. And that is then used in the background to answer questions like what clinical findings are associated with breast cancer. Then the taxonomy is also used to improve search very practically. So for example, when you key in search terms, this taxonomy gives you additional words that are similar, could be synonyms, but could also be that you maybe have entered the name of a disease and you get some symptoms suggested as well, or maybe some drug names suggested as well, because that's all interlinked in the background. And again, when new medical information comes out, those linkages, those knowledge graphs get updated. And furthermore, other things like refinement of search results is also possible. So this is, I think, a really nice example, which I'll try to describe to you. I said at ELSEVIER we have many different products. On the right-hand side, you see a product that's used by medical students, but we've also recently acquired a platform with a lot of videos, which are also very relevant for medical students. So we've used Wave2Vec to convert those videos to text, extracted all the medical concepts. There were also some that we didn't have yet, so we used that to enrich our taxonomy. And then we have the three-dimensional anatomy platform that I showed you earlier on. And we've now been able to interconnect that all so that medical students can go from one platform to the other. This is an example of a dashboard. I mentioned to you that we have education products for nursing students, and it's actually the institute where the nurses do their education that licenses this product from us. So they provide the material to the students. And with this dashboard, the institute can see which students might be at risk of failing, so they get that data. And we've been able to make that prediction because already for years we get the data back from the students with regard to whether they passed or not their national test. So using that learning and using machine learning technology, we've been able to predict quite well who needs to do some additional studying to pass. So this is considered a very useful function for the institute and will hopefully also help the outcomes of the students. Then one more example I would like to give is what we call internally topic pages. We have a lot of scientific content on our platforms, not only medical, also scientific content. And we have built, using deep learning technology, a way to extract snippets from that content, a little bit like you've seen with Google when you do a search. There's a little bit more information. It's kind of, for example, a collection of 8 or 10 snippets on the topic that you've been searching for. And that is freely available to everyone. So when you do a search on a topic, you can get that page with snippets. And we have, 363,000 topic pages. So that's a huge amount. And we get 23 million visits to this content. So I would really recommend to check it out. And you can also link to the source content if your institute is subscribed to it. Then lastly, I would like to end with a quote. And this is a quote from Kumsal Ayabasit, our CEO. And you might have seen on LinkedIn that recently she won a prize because she's an amazing CEO. And she's saying, our hope and ambition at Elsevier is to work constructively with all the stakeholders in the ecosystem of research to tackle the grand challenges that our society faces and to evolve our services for a better future. And being focused on that is what got me, still after 23 years, very excited being in this company, working with these great customers and colleagues. And yeah, very excited being here, and thank you for your attention.